Okay, it looks like there might still be a couple trickling in, but it's 3 after, so let's go ahead and get started. Welcome to the MIPS 2022 What's New webinar. Everybody will be in listen-only mode. If you have any questions during the presentation, there is a questions window in the menu. Feel free to submit those there. If we have time at the end, we will get to those. If not, we will follow up after. Everybody will receive a recording of the webinar as well as a link to the presentation afterwards. Usually it comes out about a day or so after the webinar. Alrighty, next slide. Okay, MIPS 2022, what's new? There's our questions box. Again, you'll see that at the bottom right menu, and feel free to submit anything you have as we go along. All right, a few things about eMedApps. eMedApps is a healthcare information technology services company providing practices, clinics, and hospitals with a full range of services, as well as a suite of products that are designed to increase efficiency and facilitate communication. We were founded in 1999. We work as a partner with NextGen since 2001. We've worked as a subcontractor for NextGen. We also serve other EHRs, and we have served healthcare clients across the USA. And we also provide a specific line of services and products just for NextGen. All right, we're also out there on all the social media platforms, so be sure and follow us. We've got Facebook, Instagram, Twitter, LinkedIn, and we have a YouTube channel that has many recordings out there and some great stuff for you to look at. So just search for eMedApps on all the platforms. We'd love to have you follow us. All right, about our presenter today. Christina is our presenter today, and she is a senior analyst here at eMedApps. She's been with us about 5 years. She's a wealth of knowledge. She is certified in MIPS. And then in her spare time, she enjoys going to concerts and enjoying the renovated downtown city of Detroit. So welcome, Christina. I'll pass it on to you.
All right, thank you, Holly, for the introduction, and welcome everyone. It's kind of hard to believe that we're already almost at the end of our first quarter for data collection in 2022. It's crazy how time is already flying by this year. I'm going to jump into the changes and highlights for this reporting year, but I first wanted to talk about the payment adjustments that you're receiving in 2022 based on your 2020 data submission and your final score and outcome that you received. So as a reminder, your 2022 payments are affected and based on your participation, performance feedback, and your final score that you received in 2020. In this slide, you'll see that the impact of your payments will be in the form of a positive, neutral, or negative adjustment. Next slide. Your 2020 final score received just determines how determines the payment adjustment that you're seeing in 2022. So when your adjustment is determined, the final score is compared to the program performance thresholds, which in return determines a positive, negative, or neutral adjustment, and that's applied to covered professional services. As a reminder, the performance threshold was set at 45 points for the 2020 reporting year. So that means if your final score was 45 points or higher, you avoided a negative payment adjustment. The exceptional performance threshold was set at 85 points. So again, if your final score was 85 points or higher, you were in the pool for that additional exceptional performance adjustment. Next slide. You can see on the QPP graphic shown here how your kind of final score and program thresholds determined the type of your adjustment that you're going to receive in 2022. So 45 to 84.99 points, you're in that positive adjustment realm. 85 to 100 points, you're in that exceptional performance threshold realm. Next slide. So as I'm working with many different organizations, I see the effort given and the effort given to achieve and meet all these different program requirements. And many people ask, so why is the payment adjustment I receive so small? Well, CMS notes that the 2022 adjustments were modest, they say, due to a couple different things, including your high program participation. There was also all of those COVID-19 flexibilities that they provided. And then a large number of participants scored over and above the 45 points. So the payment adjustment distribution was affected because the providers that didn't submit any data received that neutral payment adjustment because of those COVID flexibilities instead of the maximum negative adjustment. So all of these different areas impact that final overall adjustment given to all people participating in the program. Next slide. Another set of questions that come up usually surround the program scaling factor and budget neutrality wording and what it all means. So just wanted to quickly review what that kind of means. So by law, the MIPS program must be a budget neutral program. This means that negative adjustments that are given need to be balanced by the positive adjustments. So positive payment adjustment factors are set to be increased or decreased, and think of the word scaled here. So scaled by an amount called a scaling factor is how these adjustment factors are related. So increased or decreased based on that scaling factor. Now, it also, the law also notes that the scaling factor must be between 0 and 3, but the total exact amount just depends on how final scores across all of the participating providers are distributed. So think about overall participation and final scores throughout the country. That's what's impacting the final adjustment number that everyone receives. So this scaling factor is also applied to those that are in that exceptional performance threshold. So again, just think about overall the payment adjustment amount received is just based on total participation and distribution of final scores given to all. So many providers did successfully participate. So the distribution of positive adjustments, again, is spread across many more people in the program. So in 2020, additionally, the payment adjustment distribution was affected as well because of all those providers that didn't submit any data, and they received that neutral payment adjustment for those COVID-19 flexibilities instead of that negative adjustment. Next slide, please. So this QPP graphic provides just some information on how your adjustment is applied and what codes will display on that remittance advice document, or RA, if you did receive an adjustment. So a reminder is that your MIPS payment adjustments are applied on a claim-by-claim basis. They're applied to payments made for covered professional services. The payment adjustment is applied to the paid amount and not the allowed amount. And payment adjustments don't impact any portion of the payment that a patient may be responsible for. And to find out more about covered professional services and information surrounding all those, you can use the physician feed schedule lookup tool, and it breaks down and provides specifics related to each of those covered services. Next slide. So now that we've covered the adjustments that you're seeing in 2022 from your 2020 performance, I want to jump into a quick overview of traditional MIPS. Traditional MIPS is just one way to participate in the program, and adjustments are based on your participation and data submission throughout 4 different categories, including quality, cost, improvement activities, and promoting interoperability. The goal of the program is just to improve quality and value throughout all different healthcare systems. Next slide. In 2022, weights are applied over the 4 different categories, and the breakdown for 2022 is 30% for quality, 30% for cost, 15% for improvement activities, and 25% for the promoting interoperability. 2022 also, by law, noted that quality and cost performance category weights needed to be the same. So the weights are at 30 for both quality and cost, and then for IA and PI, they remain the same as they did in 2021 at 15 and 25%. Next slide. 2 new clinician types are added to the program in 2022, and that would be social workers, clinical social workers, and certified nurse midwives. Provider types eligible for participation in the program do continue to grow each year. So it's important to really check provider eligibility and participation status for the program and utilize that QPP participation status lookup tool provided on the website. Generally, participation in the program is expected if you bill more than $90,000 for Part B covered professional services, or you see more or see more than 200 Part B patients, and if you provide 200 or more covered professional services to Part B patients. But again, that QPP participation status lookup tool really is a helpful tool to look up all your providers' NPI information and see if you're needing to participate or if you're excluded from the program. Next slide. Your performance in the program is measured across the 4 categories, and you submit data surrounding your quality and IA category measure selections, the defined measures for the promoting interoperability category, and then the program collects and calculates cost measure information for you based off of claim information. The 4 performance categories are scored, and in the end, they make up your final score of either 0 to 100 points. And then this final score is what determines the payment adjustment applied to those Medicare Part B claims. Next slide. In 2022, CMS was required to establish a performance threshold based on final MIPS scores during the prior performance period. So in 2022, CMS finalized a a minimum performance threshold of 75 points, and that's up from 60 points in 2021. In 2022, you'll need to achieve a final MIPS score of at least 75 points to avoid any MIPS penalty. So make sure you're really kind of preparing and reviewing scores from previous years so you understand what kind of work is going to be need to put in to the program to receive that 75 points. The additional performance threshold is set at 89 points this year, and that's for that exceptional performance category. So if this year a MIPS provider doesn't participate in the program, can receive a negative payment adjustment of 9% in 2024. Next slide. In this next graphic, it shows that the performance and final scores determine the adjustment received in 2024. And in 2022, this is the last year for any kind of additional MIPS adjustment for that exceptional performance category. The maximum adjustments remain at 9%, and those will be applied for all your covered services in 2024. And then one thing to note is that beginning in 2023, the program is only going to be funded by penalty dollars. So as this program evolves and changes, it does make it a little more difficult to achieve scores that align with these thresholds that are being set. And we may see a greater number of providers that are impacted by negative payment adjustments. So 75 points or above this year is something to really pay attention to. And as noted, we want to make sure we're ready. Next slide. So now I want to dive in a little bit to the quality category. This category is all about performance and all about the performance and quality of the care that you deliver. So the available measures for this category are created by CMS, a group of medical professionals and stakeholder groups, and you'll review and select 6 quality measures that best fit your practice. In 2022, the quality category is worth 30% of your final score. There's 200 measures available in 2022. Again, a selection of 6 measures is needed, and it must contain at least one outcome and high priority measure. And your quality category performance outcome is based on a full year's worth of data submitted. So again, we're already in March, and data is already being gathered and collected for this category. Next slide. In 2022, there are 3 new quality measures that were added to the category. There is a 4th measure specific to administrative claims. The 3 new measures noted here on this slide are high priority measures. The first measure, number 481, is for the urology specialty, and it's focused on, as you can see, some bladder cancer information and the percentage of patients diagnosed, et cetera, here. The second measure is a high priority measure for the nephrology specialty. And lastly, number 483, this is another high priority measure for the family medicine and internal medicine specialties. And unlike other primary care measures for this specialty, this one is based on a patient's relationship with the clinician or practice. So if you're interested in those measures, really kind of look at the measure specifications related to them so you can understand what the specifications include for these. Next slide. In 2022, there were 15 quality measures removed from the program, and 2 specifically, number 14 and 50, were applicable to your Medicare Part B claims only. Additionally, in 2022, there were changes to 87 available measures that are existing, and there was a new specialty set for certified nurse midwives that was created. Next slide. The new administrative claims measure surrounds like clinician and clinician group hospital admission rates for patients with multiple chronic conditions. And you can kind of see the graphic here is just showing some of the needs related to this specific claims measure, 18 case minimum, 1 year performance period, and it applies to eligible groups with at least 16 providers. Next slide. Some highlights surrounding scoring policies impact new measures, measures that do not meet a case minimum, measures that don't have data completeness requirements met, and measures that don't have a benchmark. In 2022, any new quality measures that are introduced, CMS finalized a 7-point floor is established for those first performance period, and following a 5-point floor is established for that second performance period. This means, for the first performance period, if you selected a measure that was a new measure, you can earn 7 to 10 points if all the criteria is met. And that criteria would be, a performance benchmark, data completeness, case minimum criteria. In 2023, for that same measure selection, you would earn between 5 and 10 points, depending on the criteria being met. Beginning with 2023, there was some information noted in the final rule, noting that measures with a benchmark, the 3-point floor is going to be removed, and these measures will receive a 1 to 10 points. Measures without a benchmark, the 3-point current floor is removed, except for small practices, and you'll receive 0 points. Small practices will continue to earn those 3 points. Any kind of measure also in 2023 that don't meet case minimum requirements of 20 cases, the 3-point floor is also removed with the exception of small practice, and you would receive 0 points for that. Again, small practices will continue to earn 3 points. In 2022, the bonus points that were previously available for end-to-end electronic reporting and reporting any kind of additional outcome and high priority measures are no longer applicable this year. So those bonus points that a lot of us have been utilizing and getting are no longer available in 2022. That's the end-to-end electronic reporting and then reporting additional outcome and high priority measures. Next slide. An example of a benchmark is shown here. So you can see, based on how well you do for a specific measure, you can see that the point system or decile system is utilized here, kind of allowing you to see what you would get or how many points you would get for that specific measure based on how well you're doing in the measure. Next slide, please. So 2022 and 2023 requires that providers continue to meet current data completeness thresholds of 70%. So what does data completeness mean? So this isn't referring to the volume of performance data reported for the measure's eligible population. So the denominator or eligible population is outlined in the measure specification, and this identifies the population and specifics that you need to report. So to meet data completeness, you need to report performance data, and that includes performance met, not met, or any kind of exclusions or exceptions for at least 70% of the eligible encounters. And just know that incomplete reporting of a measure population could subject you to an audit from CMS. Next slide, please. So summarizing the quality category, just make sure you understand the reporting requirements. When you're making quality measure selections, make sure you're reviewing the specifications and you understand what you really need to successfully submit your data. I always suggest selecting more than 6 measures if possible, so that if you have expectations set within the organization and performance is not meeting your expectations, you have other measure selections that you can count on or that are available for you to review. And throughout the year, keep an eye on how well your providers are performing so that you can enhance some workflows or work in steps for another person to complete things so that your final performance score is turns out to be really well. Next slide. So for the cost performance category, this really just is assessing the cost of the patient care that you provide. And this program, or part of the program, calculates your final outcome all surrounding your Medicare claims. And this is, they're looking at your Medicare claims to determine the cost of the care you provide to certain patients. Next slide. In 2022, the final rule added 5 episode-based cost measures, 2 procedural measures, 1 acute inpatient measure, 2 chronic condition measures being diabetes and asthma or COPD. Nothing big in 2022 for cost. Improvement activity category is next, and this category focuses on how you improve your care processes and how you're enhancing your patient engagement in their own care, and how you increase access to care. Next slide. In 2022, some new updates for this category. The 7 new activities were added to the inventory for the improvement activities. There were 15 modifications made to 15 current activities that are available. A lot of the changes were surrounding health equity and language related to equity. There were 6 activities that were removed from the IA inventory. And in the final rule, it also allows CMS to suspend an improvement activity if there's reason to believe that that the continued collection raises safety concerns or is obsolete. And if for some reason they did suspend an improvement activity for these reasons, they would immediately notify clinicians and the public through normal communication channels, and then would propose to remove or modify the activity in the next rulemaking cycle. Next slide. The 2 new activities, or sorry, 2 new high priority measures were released, and then the 5 new medium weighted activities were also noted here. High priority measures, you can see again, they're really based around health equity and language. Next slide. 6 activities removed and are included here. So BE 13, PSPA 11, BE 17, BE 18, BE 20, and BE 21 are all removed from the program. So if you were planning or had previously submitted and created documentation around these categories or these measures, just make sure you make note of that and really start reviewing the activities that are available for this year and identify activities that are appropriate for your practice. Next slide. So promoting interoperability is our next category, and this category promotes patient engagement and the electronic exchange of health information using our certified electronic health record technology. In this category, we're reporting a single set of objectives and measures. Next slide. In 2022, there were a few announcements in this category. Number one is that CMS will automatically apply the reweighting to clinical social workers and small practices. So there's no need for a application. Finalized changes to this category also included revisions to the reporting requirements for public health and clinical data exchange objectives. Next slide. In 2022, CMS does require reporting of the immunization registry reporting measure and electronic case reporting measure unless you can claim an exclusion. They also added a fourth exclusion to the electronic case reporting for 2022, where if you're if you do not have certification for your EHR prior to the start of the 2022 performance period, the fourth exclusion can be utilized there. The public health registry reporting and clinical data registry reporting, along with syndromic surveillance reporting measures, are optional this year. And if you do submit data for them, you can earn 5 bonus points in this way. Any kind of submission of yes to perhaps all 3 of these measures won't give you more than 5 bonus points. So just be aware of that. It's great if you can do all that, or if you do submit data for all those, but you won't earn more than 5 bonus points for those optional measures. Next slide, please. The 2022 final rule also included a new required measure called the Safety Assurance Factor for EHR Resilience Guides, or SAFER guides. This measure requires all providers to attest to conducting an annual assessment using the SAFER guides beginning this performance period, 2022. They also finalized and modified the Prevention of Information Blocking Attestation Statement. Next slide. So again, that new required measure, self-attestation measure for 2022 is all along the safety assurance factor. And this utilizes what's called a SAFER guide to identify recommended practices that optimize the safety and safe use of your EHR. Next slide. They do have 9 guides that are designed to help you conduct your self-assessments and address outcomes of the self-assessment that surround safety and the safe use of your EHR. They have foundational guides, which include those high priority practices and organizational responsibility guides. They have the infrastructure guides, which contain contingency planning, system configuration, and system interfaces. Additionally, they have that clinical processes guides, which include patient identification, CPOE with decision support, test results reporting and follow-up, and then clinician communication. And on the healthit.gov website, they note that most organizations will start with those foundational guides. And as you get more comfortable and proceed through all the different available guides, you would address different areas and start making a list of your greatest interest or concern on items identified after doing these self-assessments. Next slide. So the recommendation is to use these SAFER guides to do this self-assessment and find and identify areas that deal with all these different safety concerns. So there are a lot of fast-moving changes in healthcare. We all know that. So we have technology, we have practice standards, we have regulations, different policies. So as we're kind of going through these guides, we really need to think about all these different areas and changes that might be applicable as healthcare kind of grows and moves as we're utilizing these different guides that they've provided. And ultimately, always keep in mind that the goal will be to improve the overall safety of your EHR and your health care system. Next slide. Just showing you kind of an example here of one of the guides and the checklist used within the guide. So this area of the guide allows you to enter and put in information as you're going through this self-assessment. And then your selections in this checklist area will automatically kind of update this specific worksheet and correspond recommended practices that are available as you're going through the checklist. Next slide. They do note that as you're kind of going through these self-assessments, that you'll want to pull in a lot of different people, and it might require you working with, both inside and outside team members. So, if you're doing, hosted, you'll want to be pulling in your, hosting team, any kind of diagnostic services that you might be utilizing. There might be questions related to that where you might want to be, working with your lab vendors and things like that to ensure that the flow of information is safe information. The CMS also suggests that clinical leadership is also engaged in working through these with the team and designing plans and policies around how you're going to deliver safe, high quality care to your patients. So it's really important for your providers, your staff members, your executive teams, leadership, management, all of the different areas, IT, all be involved in these self-assessments, and that you guys are really understanding and going through the process to either make adjustments to practices that you already have in place or create new practices, outline kind of any needs, and really start making a plan to mitigate any kind of high priority or safety risk that is noted on these SAFER guides. Next slide. As I noted previously, as you're going through the checklist, this area of the recommended practices also allows you kind of to enter and print information about your self-assessment. It also kind of gives you examples of practice scenarios or useful practice scenarios here. So you can really work through and understand what areas you've identified and start making your recommendations and your plan so that you can implement it. This information will definitely need to be part of your audit binder. Next slide. Additional self-attestation measures include that adjustment to the prevention of information blocking attestation statement. So the wording, I just noted it here for you guys. They just made some changes to that. Your security risk analysis is still in play again this year. Again, for your security risk analysis, you're just wanting to make sure that you've reviewed the SRA and that any kind of adjustments or updates needed are identified and noted within that security risk assessment. Additional requirements that you need to earn a score greater than 0 in this category is using 2015 CERT. Submit data for at least, or for a continuous, I should say, 90-day performance period for their promoting interoperability category. You'll also have another self-attestation statement where you're attesting to work in good faith with the ONC if you get a request from them, and that you're meeting all the required measures, or that you've qualified and claim an exclusion for any of the required measures. Next slide. So I want to talk about the MVP program just because this is the year to really kind of start thinking about this portion of the program. So CMS does intend to transform our MIPS program through this MIPS value pathways, MVPs, and then the APM performance pathway is the APP. Today, I'm just specifically going to talk a little bit about the MVP program. Next slide. So in 2023, you'll be able to report for this MVP program and which will eventually replace the traditional MIPS program. The MVP program will be voluntary from 2023 to 2027. And the goal of this MVP program is just to align and connect measures and activities across all 4 categories: quality, cost, promoting on interoperability, and improvement activities for different specialties or conditions that a patient might have. Next slide. So, like I said, the MVP program connects those activities and measures from those 4 MIPS performance categories. They're relevant to a specific specialty, a medical condition, or an episode of care. They include the promoting interoperability performance category and population health claims-based measures, and it's broken down as a foundational element. They also include relevant measures and activities for quality, cost, and improvement activities. And like I said, the framework aims to provide meaningful data and feedback to clinicians and patients by comparing the performance of clinicians or specialties who report on the same MVP selection, so that it enhances information provided to your patients and through public reporting. Next slide. In 2022, they did finalize 7 MVPs that will take effect in 2023. So you can kind of look through those MVPs that are available and review the measures and review what's in the specific specialty or measure that MVP that you select, so that you're ready and prepared to fill out that application and let them know you're going to participate in the MVP category. Next up. Again, the category breakdown here is 5 different categories included in the program. The first 3 categories are specific to the pathway that you select. So those are called your MVP layer, quality improvement activities and cost. And then the next set includes your foundational layer made up of those 2 different population health and promoting interoperability measures. And the measure lists are the same regardless in this foundational layer. Those are always going to be, the measures are always going to be the same no matter which MVP pathway you select. Next slide. So the reporting requirements for your MVP layer, you'll submit 4 different quality measures. And note, 1 selected measure will be an outcome measure. You'll select and submit either 2 medium weight or 1 high weight improvement activity. And then CMS will continue to calculate your performance on cost using your claims data. Within the foundational layer, you'll select and submit 1 measure from population health. And then you're promoting interoperability measures. There'll be 4 to 5 required measures. And you'll also note your EHR cert ID. You'll continue to do a security risk assessment. You'll continue to attest to that prevention of information blocking and ONC direct review statements. And you'll also continue to utilize and do those self-assessments using those SAFER guides that we just spoke about. Next slide. In my next slide here, I'm going to just show you kind of a breakdown of one of the MVPs that's been finalized for heart disease. So you can go ahead and go to the next slide. You can see here in the slide that they have the quality measures noted here. And again, you'll be selecting from this list only of quality measures that you're going to submit data for. You'll see in the middle that contains the improvement activities that you can select from. Again, 1 high priority or 2 medium weighted. And then cost. This is the information that they're going to be basing your cost score off of. Next slide. For the same MVP pathway heart disease, you'll see that your foundational layer for your population health measure located here. And then your promoting interoperabilities, we kind of went over regarding some of those specifics related to that category for the foundational layer. Again, these will continue this foundational layer no matter which pathway you choose or select. These will remain the same across all. So again, as they are getting ready to launch the program, 2022 will be your year to kind of prepare and get yourself ready for that transition to MVPs that are available in 2023. They want to give you time to review all the requirements, make sure your workflows are updated if needed, prepare any kind of technology or EHR systems and update those if you need to. They note for 2023, 2024, 2025, again, you'll be optional to participate. Beginning in 2026, your multi-specialty groups will be forming subgroups to report different MVPs. Next slide. So again, 2022, take the time this year to prepare, start familiarizing yourself, review and decide if one of those 7 finalized MVPs are right for you. Really dive in and review your workflows to make sure that you're going to be able to capture all the data that's needed. Update your health IT systems if needed as well. Next slide. So I know I've gone through a lot of information today, and my hope is that some of your questions have been answered. Although we don't have time to address questions today, like Holly had said in the beginning, we have noted any questions that have come in, and we'll be reaching out to you to provide any kind of follow-up. So thank you so much for all joining today and taking the time out of your day for this presentation. Have a great day, everybody.